New guidelines regarding childhood obesity have brought mixed responses from parents, doctors, and scientists alike. These responses have prompted celebration.
The Obesity Society officially supports the evidence-based views in in these guidelines. Especially
Concern.
It's a matter of, once again, bringing in the family together. So it's more face-to-face interactions. It is having the family there as well.
And even discussed.
I'm appalled. It's just, it is so unfair to a child. I have grandchildren. I don't ever want my grandchild to think that her body is wrong.
The American Academy of Pediatrics has released new guidelines for the first time in 15 years to treat childhood obesity, which has been rising over the past 5 years. These guidelines include early, intensive treatment and even recommends weight loss surgery for pediatric patients. Dr. Jeremy Brown is a family doctor at Baylor Scott & White Health who specializes in pediatric patients.
Clinical obesity, typically we'll look at that as a BMI greater than or equal to the 95th percentile of an individual's sex and age. So I think the concept of the bariatric surgery, I'm anticipating we'll look at that as a last resort. There's so many other things that can be done before then, and the portion about...
There are two types of bariatric or weight loss surgery for pediatric patients. A sleeve gastrectomy is when a surgeon removes 80 to 90% of a patient's stomach, which can impact how much a child can eat, while a gastric bypass makes the stomach smaller, limiting how much a child can eat and reduces the nutrients that a patient can absorb. For survivors of an eating disorder and diet culture, it's a different story.
That's not fair. That is, the medical profession has the famous line where first do no harm. This is creating an enormous amount of harm. And to think that this is the American Academy of Pediatrics, they should know better.
Lesko is the creator of the social media platform Diets Don't Work, a page designed to take down diet culture and to encourage others in their recovery.
How do we direct those questions? Well, we tell them that all foods are good and that there are no unhealthy foods. And actually, the biggest prevention for eating disorders from a parent is to have a good relationship with food yourself.
Despite the controversy surrounding these new practices, experts say supporting children starts through the family.
The children and the parents to learn about what eating right is and making good decisions with exercise so they can take those tools with them for the rest of their lives.
I'm Mackenzie Bryce, reporting.